Hi, I'm Dr. Mills, and I'm a psychiatrist in California with my own private practice called Freedom Psychiatry, because mental health is freedom. My practice focuses on achieving mental wellness using medications, nutrition, and lifestyle changes. I will be posting videos regularly that answer common mental health questions. Today, we're talking about lifestyle changes and how that affects your mental health and your fertility.
I have a question, Dr. Mills. This came in. I know I need to be stable mentally to be healthy and have a healthy baby. Besides medications, are there other ways to improve my mental health and increase my fertility?
Yes. So that's the topic today is our lifestyle changes. So the cool thing about nutrition and lifestyle changes is that whatever is going to help your mental health is also going to improve your fertility. Now, there's no one size fits all to nutrition and lifestyle change recommendations, but there are some general principles that are helpful. The first thing is that if you plan on being pregnant, you need to be on a prenatal vitamin. Prenatal vitamins help healthy fetal development and help the soon to be pregnant person remain healthy throughout conception, pregnancy, and postpartum.
Excellent. That's great, Dr. Mills. Thank you. Here's another question. I know to avoid deli foods and alcohol, but are there special foods I should eat?
Eating healthier starts with looking at what you're currently eating and drinking. And when I say looking at what you're currently eating and drinking, I mean really think it through. Take out a piece of paper and write it all down what you eat for breakfast, lunch, and dinner and snacks. Or you can type it if you prefer. And then after you've written it out, really look at the paper and see what it is you're eating. So, what do you see? Do you see a lot of fast food? Maybe some processed foods? The rule of thumb to identify a processed food is that if it comes in a package, it's probably processed. Also, keep in mind that a processed food may even claim to be healthy. It may say low fat or say only 100 calories. How about are you drinking soda? And even diet soda counts. So, wherever you see soda, I recommend replacing it with water or flavored water or even flavored sparkling water if you really like the bubbles. For processed foods and fast foods, I recommend replacing those with whole foods as much as possible. Now, whole foods is not just the name of a grocery store, it is an entire edible item that comes from nature. Examples are vegetables, fruits, whole grains, and lean meats and fish. In general, there's no such thing as too many vegetables. You can have veggies as snacks, with dinner, lunch, or even breakfast if you like. Some people don't like raw vegetables, and that's okay. You can cook them. Just keep in mind that you want to use healthier fats like canola or olive oil when you cook them. Also, if you're trying to get rid of some oils and reduce calories, what you can do is you can steam the vegetables for a lighter way to cook it. Fruits are also healthy for you in moderation. Ideally, you want to eat the whole fruit and not juice because juice has a lot of sugar in it. That amount of sugar can lead to gestational diabetes or diabetes.
Thank you, Dr. Mills. You were talking a lot about eating unprocessed foods. Do you recommend a gluten-free diet for better fertility?
So, the gluten free diet, when we're talking about whole grains, is where things can get a little tricky. Some people are very big proponents of eating a completely gluten free diet. Other people say that really only people with very specific conditions, such as celiac disease, should have a gluten free diet. My viewpoint is I'm actually somewhere in the middle of that spectrum. Of course, if someone has celiac disease, then they really do need to be on a gluten free diet to avoid illness. Now, Some other conditions seem to respond pretty well to gluten-free diets. Some of those conditions are migraines and epilepsy. There's some emerging evidence that a subset of people with schizophrenia actually respond quite well to a gluten-free diet. There's even some research now looking into depression and anxiety and how well people respond to a gluten-free diet. The research on this is somewhat mixed. They find some people do well with a gluten-free diet and some people don't seem to have a difference. So it's hard to say. I usually tell patients that if they're interested in trying a gluten-free diet for about 3 to 4 weeks and then seeing how they feel, I am more than happy to help them with that endeavor.
Thank you, Dr. Mills. What about meat? Will eating a plant-based diet improve my mental health and fertility?
When talking about meat in people's diets, this is another sticky topic. So, some people really insist on vegan diets while other people just don't. Again, just like the gluten free diet, I'm somewhere in the middle about this. I think it's perfectly fine if you want to have a vegan diet, completely plant based with no animal products. However, it's really important to make sure that you get all of the nutrients that you need. That can be difficult in a vegan diet. So, if we're talking about certain nutrients that you have to watch out that you're getting enough of, vitamin B12 is a difficult one for some people who are vegans. What you have to do, because plants don't make vitamin B12, is obtain that vitamin through supplementation. Also, I recommend that you still focus on whole foods, limiting processed foods, not eating too many carbohydrates, and having a lower sugar content in your meals to make sure that you're being as healthy as you can. Because, you still can have a lot of processed food and be a vegan, but that's not going to help your mental health or your fertility. Now, on the other side, if you're interested in continuing to eat meat products, I think that is fine also. But you just have to pay attention to what types of meat you're consuming. It's important to pay attention to lean meats such as chicken and fish and try to eat those more often than you're eating red meats and highly fatty meats. In addition, portion size makes a big difference. In general, we as Americans eat way more meat than we need to eat. So, what I would recommend is replacing some of the meat that you're eating with vegetables to try to balance it out and give you more of a healthy diet so that you can boost your mental health and your fertility.
Excellent, Dr. Mills. Here's one last question. I've had trouble getting pregnant. My mother says I should rest more. Does exercise affect my mental health? Can it affect fertility?
What an excellent question. So, I will be talking about sleep in more depth in a future video and how important it is to your mental well being and to your fertility. You do want to make sure you get those 8 hours a night, but it is equally as important to make sure that you get regular exercise. The hard part about exercise is sticking with it. The key to sticking with an exercise routine is to find something that you enjoy doing. So, if you do not like going to the gym, don't go out and buy a membership to one, because then it'll just be too hard to stick with it. Let's say maybe you like to dance. If you like to dance, then you should go out with your friends and go dancing. Just skip the alcohol if you're planning on becoming pregnant. Or you can join a dance class. That would be excellent exercise. Let's say instead of dance, you like to spend time with your dog. That's a great way to get exercise. You and your dog can go walking, and then especially if you try to walk farther than you usually do, and maybe keep the pace up at a faster pace than usual, maybe instead of walking, you even try running and see if you like it. Those are good exercise ideas. Just make sure you brainstorm the types of things you like to do. Really, the important part is to find a reproductive psychiatrist that listens and is willing to work with you to meet your mental health and fertility goals. If you would like me to be your reproductive psychiatrist, please go to my website, freedom-psychiatry.com, click on the book appointment button, and schedule your free 15-minute mini consultation with me, Dr. Mills. Thanks so much for listening. Have a great day. And remember, mental health is freedom.